Hello everyone and welcome to week number 8. So this week we have probably the most chapters that we've had all quarter that we need to discuss, but they all seem to really work together, so it's very nice. Even though there's 3 of them, they do seem to flow together very nicely. So this week we have chapters 53, 54, and 55 to work with. Now for the day 1 video, I'm going to focus on chapters 53 and 54, and though it might sound a little backwards, I'm actually going to start with chapter 54, because I feel like that's the one that you need to learn first, then we can move on to 53. So chapter 54 is going to be focused on pharmacology. Now pharmacology is the study of medications and drugs, including their form, their intentions for use, and their effects. Now in week 7, if you remember, we had that very large worksheet that we worked with that helped us to learn the different drug classifications, things such as antibiotics, antiarrhythmics, things like that. It also taught us about the schedule of drugs, schedule 1, 2, 3, and 4. But what we did not discuss was the naming of drugs. How do we come up with those names? So typically, drugs have 3 different names. They have a generic name, a brand name, and a chemical name. Now, a generic name is often called the official name of the drug. It is typically written in lowercase letters, and it is the legal name for the drug. So every time you see a generic name, you'll know it's a generic because it will not be capitalized. It will be in lowercase letters. A brand name is typically written with a capitalized and first letter. This is the name that is typically given to a specific drug by its manufacturer. And a chemical name is the formula of the name used by the manufacturer and the pharmacist. So as you can see, I put up an example here. I've given you the 3 names of the medication that we all know, Tylenol. The brand name for Tylenol is typically Tylenol, that is capitalized. The generic name is acetaminophen, and the chemical name is N-acetyl. Those are the 3 names for something as simple as Tylenol, a name that we all know. So also in week 7, we did not discuss this, but it was talked about in the chapters you read, was how medications are administered. So there are several ways that we administer medications, and those are called the routes of administration. Those could be things such as oral, or given to them in a pill form in the mouth. Parenteral, which is something that is given to them outside of the GI tract, typically injections or IV solutions. Sublingual, which means that it goes under the tongue and it is absorbed into the mucous membranes. Inhalation is something that is breathed in through the lungs. Topicals are something that we put on the skin that gets absorbed into the skin through the skin and the mucous membranes there. Drops are something that we can put in anywhere. Typically, though, it is the eyes or the ears. And suppositories, or a rectal method. So I'm not going to go into too much detail about those. We'll talk a little bit more about those in the day 2 video. So for today, you just need to know the different routes of administration, as well as maybe knowing the different patient rights of drug administration. As you can see here, there are 6 of them listed. You want to make sure that you have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. For this chapter, most of it will be reviewing, as it's something that we've already previously discussed, but one new set of information will be how to read and write drug prescriptions. Now, medical prescriptions are typically written by the provider, as we cannot dispense medications, but as medical assistants, you can set these prescriptions up for refill for the doctor, so all he will have to do is sign them. With that being said, it's really important that you understand the symbols, the prescription pad itself, and the abbreviations that we use. It's also important that you understand the different parts of a prescription. So things such as the superscription, the inscription, the subscription, the sig or the signia. You want to make sure that the physician's name, address, phone number, and DEA or drug administration number are there if they're needed, the number of refills that the patient has, and the dispense as written line. So when we're talking about a superscription, this is the patient's information. It's their name, it's their date of birth, and it's their address. The superscription also will include the date the medication script was written. An inscription gives the name of the medication and the dosage of the medication. So for this example, the inscription here is amoxicillin 500 milligram capsules. The subscription is the amount of medication that the pharmacy is to dispense to the patient. The sig or the signia are really the instructions for how a medication is to be taken. Then again, you have the physician's name, address, phone number, and DEA number. So this information needs to appear on all scripts. The DEA number is the Drug Enforcement Agency number that's assigned to physicians that states that they are able to prescribe, dispense, or administer controlled substances. If the medication that you're writing is not a controlled substance, it's not needed on the prescription. So in this example here, we have amoxicillin. That is not a controlled substance, so it does not need a DEA number. And the last one is the dispense as written line. This states whether or not a generic medication can be given, or if it's supposed to be a brand name only medication. So in the lab this week, we will be dealing with and practicing this. So make sure that you come prepared knowing how to not only read a prescription, but possibly how to write one as well. I know that it will be part of either maybe a final or a homework assignment this week as well. All right, we're going to move on to chapter 53, and this chapter is focusing on math. So I don't want you all to panic. I know that I've already heard you say, some of you, that how much you hate math. Trust me, I am not a math whiz. This is not something that is my favorite thing to do, but it's so easy to do this type of math that I know that you all can do it. We will be spending a great deal of time in the lab on day one dealing with this as well, so make sure that you bring a calculator to the lab. Your phones will work just fine, but if you have an actual calculator, that might be easier to use. So I put up this little meme here because I think that's pretty typical of how people feel, right? You think you know the answer, you look at the question and the answers, and you feel like flipping your desk. But I don't want you guys to go there. The math that we'll be using is something very simple. We'll be using, adding and subtracting, multiplying and dividing, but then you'll also have to know how to read and write fractions and decimals. Simple as that is for this week. So when we are calculating and using the calculation systems, there are two systems that we use to calculate medication doses. We use the apothecary and the metric system. Now, most physicians in the United States will use the metric system. We don't typically use the apothecary method anymore, but it's really important that both are known and understood by you guys and all other medical assistants. Now, I'm going to strictly focus on using the metric system, as that's the one we will be responsible for knowing and reviewing, and I would hope that you guys will be able to read and understand the apothecary method for yourself as you read through the chapter. Now, the metric system is most commonly used system for dose calculations and conversions. It uses the prefixes kilo, hecto, deca. You have your base unit, then deci, centi, milli, and micro. Metric conversions are accomplished by multiplying or dividing by 1,000. And we use the common metric units liter, gram, and meter. Liter for volume, gram for weight, meter for length. In the metric system, dosages are written as decimals first, and then the unit measurement. So for example, when you see something like 25 milligrams, you write the number first and then you write the unit of measurement. Alright, so let's go ahead and dive into the discussion of dose calculation. There are many factors that are involved when physicians calculate the correct dose of medications for a person. That includes not only their age and their weight, but also their current state of health, as well as any other medications that they're taking. The first step in any drug calculation is to confirm that the systems of weight and measurement are the same as the supply on hand. If they are different, we'll need to do what we call a conversion and convert them to the same system. So if my order said something like 25 grams, but on hand I had 50 milligrams, I would need to convert my grams, which is my order, to match what my supply on hand is. There are two method systems that we use for dose calculations. We use the ratio method and the formula method. The ratio method establishes a relationship between the two quantities. It compares the drug ordered to the amount on hand. So just like I said, that would be the one that we're going to use the most because we want to make sure that our order matches our supply on hand. The formula method is uses a simple method to determine the amount of drug needed in the equation. It takes the desired amount, or the amount that was ordered, divided by the dose on hand times the quantity of the supply on hand. So I know that these two are very confusing and they're very difficult to explain or even understand via a video like this. So again, we will be spending a great deal of our class time and day one working strictly on these, and as well as making sure that we get through our homework and using great examples. So if it doesn't make sense right now, don't panic. Come to class on Tuesday, and we'll be able to work through these. Now, the last thing that I want to talk about before I end the video here is I want to talk about discussing the ways to calculate dosages of medication for pediatric patients. Obviously, our pediatric medications and their doses will be very different from adults as they are essentially tiny humans. So there are several rules or laws that we use to calculate dosages for pediatrics. We use Clark's rule, Fried's rule, Young's rule, and the West nomogram. Clark's rule is the one that we use the most, and it is so commonly used for drug dosages for children, but it's based off of their weight versus anything else for them. Fried's law applies to children who are typically under the age of 1, so newborns and infants. Young's rule is something that we use after they turn 1 and typically up until the age of about 4 or 5. And the West nomogram is what we use the child's, what we call their BSA, or body surface area. And we calculate that to get the appropriate dose for them based off of the adult body surface area, or adult BSA. Again, these can be very confusing if you're not using them and not looking at them right offhand and physically using them. So again, we'll be working with these as we come to class in day 1. So please make sure that you read chapters 53 and 54 prior to coming to class, so that way when you do get there, you do have a good sense of some of the questions that you need to be asking. Also, make sure that you have a calculator with you. That will be kind of the number one thing that you need to have heading into class this week, so that way you're prepared. Also, make sure you have a pencil and some scratch paper, so when we're doing some of these things, you can take some notes on the side. If you have any other questions or concerns, please make sure that you bring them to class on day 1 so I can help address them while we're on campus together. Otherwise, I will see all of you on day 1 of week number 8. Bye, guys.